The human skeleton is a remarkable framework consisting of 206 bones that provide structure, support, and protection for our bodies. Did you know that the smallest bone is the stapes in the ear, measuring just around 0.1 inches? Meanwhile, the largest bone, the femur, can be over 18 inches long. Our bones are not just rigid, they are living tissues that constantly regenerate. In fact, every 10 years you get a completely new skeleton. This incredible system also houses bone marrow, where blood cells are produced. And let's not forget the joints, which allow for movement and flexibility. Without them, we'd be as stiff as a board. The skeleton truly is a masterpiece of evolution, enabling us to stand tall, run, jump, and even dance. The adult human skeleton consists of 206 bones, with the axial skeleton comprising 80 bones, including the skull, vertebral column, ribcage, and sternum, and the appendicular skeleton consisting of 126 bones, including the upper and lower limbs, pelvis, and shoulder girdle. The functions of the skeleton include support, providing a framework for the body, protection, shielding internal organs such as the brain, heart, and lungs, movement, facilitating movement through joints and attachment points for muscles, blood cell production as bones produce blood cells in the bone marrow, and mineral storage as bones store minerals like calcium and phosphorus. There are different types of bones. Long bones like the femur, humerus, and tibia. Short bones like carpals and tarsals. Flat bones like the sternum, ribs, and scapulae. Irregular bones like vertebrae, pelvis, and skull bones. And sesamoid bones, which are embedded within tendons such as the patella. Joints can be classified as fixed joints, which allow no movement like the skull bones. Cartilaginous joints, which allow limited movement like the joints between vertebrae. And synovial joints, which are freely movable like the elbow, knee, and hip joints. The skeleton begins forming in the embryonic stage. Bones grow through childhood and adolescence, with most growth occurring in the long bones, and throughout life, bones undergo remodeling, with old bone tissue being replaced by new tissue. The axial skeleton is the backbone of our body, quite literally. Comprising 80 bones, it includes the skull, vertebral column, and rib cage. The skull protects our brain, housing our senses and allowing us to interact with the world. The vertebral column, or spine, is a marvel of engineering, made up of 33 vertebrae that provide both support and flexibility. It's like a sturdy yet flexible tower, allowing us to stand tall and bend with grace. The rib cage, with its 12 pairs of ribs, shields our vital organs like the heart and lungs, while also playing a crucial role in respiration. Together, these structures not only protect but also support our body's framework, enabling movement and balance. The axial skeleton is truly the core of our physical existence, a remarkable blend of strength and agility that keeps us upright and thriving. The axial skeleton consists of the skull, which has 22 bones, including the cranium with 8 bones and the face with 14 bones. The vertebral column has 33 bones, 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. The ribcage consists of 24 bones, which are 12 pairs of ribs. The sternum has 3 bones, the manubrium, body, and xiphoid process. The axial skeleton protects internal organs such as the brain, spinal cord, heart, lungs, and digestive organs. It provides support as a framework for the body and facilitates movement, allowing for flexion, extension, rotation, and lateral movement. The skull is divided into the cranium, which protects the brain, and the face, which forms the facial structure. The vertebral column is divided into the cervical spine with 7 vertebrae that support the head, the thoracic spine with 12 vertebrae that support the rib cage, the lumbar spine with 5 vertebrae that support the lower back, the sacrum with 5 fused vertebrae that forms the base of the spine, and the coccyx with 4 fused vertebrae that forms the tailbone. The rib cage is composed of true ribs, which are 12 pairs that are directly attached to the sternum, false ribs, which are 6 pairs that are indirectly attached to the sternum, and floating ribs, which are 2 pairs that are not attached to the sternum. The skull, a remarkable structure, is more than just a protective casing for our brain. It's a complex masterpiece of evolution, made up of 22 bones that fuse together to form a sturdy yet lightweight framework. Each bone has its purpose. For instance, the frontal bone shields our forehead, while the mandible or jawbone allows us to chew and speak. Did you know that the human skull can change shape throughout our lives? In infants, the skull has fontanelles, or soft spots, that allow for growth and brain development. As we age, these bones fuse, creating a solid structure. The skull also houses our sensory organs, our eyes, ears, and nose, making it essential for perception and interaction with the world. And let's not forget about the fascinating stories our skulls tell. Forensic scientists can determine age, sex, and even ancestry from skull features. So the next time you think of the skull, remember it's not just a bone. It's a key player in our identity and survival. The skull is composed of the cranium, which protects the brain, and the face, which forms the facial structure. The cranium consists of 8 bones: the frontal bone, parietal bones, occipital bone, temporal bones, sphenoid bone, and ethmoid bone. The face is made up of 14 bones: the vomer bone, zygoma bones, mandible, maxilla bones, lacrimal bones, palatine bones, inferior nasal conchae, and nasal bones. The skull protects the brain, supports the face, provides attachment points for muscles, blood vessels, and nerves, and forms cavities for the eyes, nose, mouth, and ears. It features sutures, which are fibrous joints that connect skull bones, fontanelles, which are soft spots in the skull where bones haven't yet fused, sinuses, which are air-filled cavities within the skull bones, and foramina, which are openings for blood vessels and nerves to pass through. The skull begins forming in the embryonic stage, and the bones grow and develop throughout childhood and adolescence. During childhood and adolescence, the skull bones fuse together, forming sutures. The vertebral column, or spine, is a remarkable structure made up of 33 individual vertebrae stacked like building blocks. It's not just a support system, it protects the spinal cord, which is the main highway for nerve signals between the brain and the body. Each section of the spine has its own unique role. The cervical vertebrae in the neck allow for a wide range of motion, while the thoracic vertebrae support the ribcage and protect vital organs. The lumbar region bears much of our weight, making it prone to injury. Did you know that the sacrum and coccyx at the base are fused bones? They provide stability and support for our pelvis. The spine also has natural curves that help absorb shock and maintain balance. So next time you stand tall or bend down, remember the incredible engineering of your vertebral column, working tirelessly to keep you upright and agile. The vertebral column consists of 33 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, fused, and 4 coccygeal, fused. Each vertebra consists of a vertebral body, vertebral arch, and processes, spinous, transverse, and articular. It provides a framework for the body, shields the spinal cord, allows for movement, flexion, extension, rotation, and lateral flexion, and absorbs shocks while distributing pressure. The cervical vertebrae are smaller, with foramina for spinal nerves. The thoracic vertebrae are larger, with facets for rib articulation. The lumbar vertebrae are the largest, with robust vertebral bodies. The sacral vertebrae are fused, forming the sacrum, and the coccygeal vertebrae are fused, forming the coccyx. The spine has curvatures. Cervical lordosis is the inward curvature of the cervical spine. Thoracic kyphosis is the outward curvature of the thoracic spine. Lumbar lordosis is the inward curvature of the lumbar spine. And sacral kyphosis is the outward curvature of the sacrum. Intervertebral discs are fibrocartilaginous discs between adjacent vertebrae. Facets are articular surfaces for adjacent vertebrae. And spinous processes are posterior projections for muscle attachment. Clinical significance includes spinal injuries such as fractures, herniated discs, and spinal cord injuries, degenerative conditions like osteoarthritis, spinal stenosis, and degenerative disc disease, and scoliosis, which is an abnormal lateral curvature of the spine. The axial skeleton is like the backbone of our body, literally and figuratively. It consists of the skull, vertebral column, and ribcage, forming a central framework that supports our structure. First, the skull protects our brain, the command center of our body, while also housing our sensory organs. Then we have the vertebral column, a flexible yet sturdy series of bones that not only supports our posture, but also encases the spinal cord, a vital pathway for nerve signals. Finally, the rib cage safeguards our heart and lungs, allowing us to breathe and circulate blood efficiently. Together, these components provide stability, protect vital organs, and enable movement. The axial skeleton is essential for our daily activities, from standing tall to bending down, making it a true marvel of human anatomy. The axial skeleton provides a framework for the body, supporting the head, neck, and trunk. The axial skeleton protects vital organs including the brain, spinal cord, heart, and lungs. The axial skeleton facilitates movement, including flexion, extension, rotation, and lateral flexion. The axial skeleton absorbs shocks and distributes pressure, reducing the impact on vital organs. The axial skeleton provides attachment points for muscles, ligaments, and tendons, enabling movement and maintaining posture. The axial skeleton contains bone marrow, which produces blood cells, including red blood cells, white blood cells, and platelets. The axial skeleton stores minerals, such as calcium and phosphorus, which are essential for bone health and other bodily functions. The axial skeleton plays a role in endocrine functions, such as regulating calcium levels and producing hormones that influence bone growth and development. The axial skeleton plays a vital role in maintaining the body's overall structure, function, and health. The ribcage, a marvel of nature, is more than just a protective cage for our vital organs. It's a complex structure made up of 24 ribs, 12 on each side, that curve around to form a sturdy shield. These ribs connect to the spine at the back, and most connect to the sternum at the front, creating a flexible yet strong framework. Did you know that the rib cage plays a crucial role in our breathing? As we inhale, the ribs expand, allowing our lungs to fill with air. This expansion is aided by the diaphragm, a muscle that sits beneath the rib cage. When we exhale, the ribs contract, pushing air out. Interestingly, the rib cage also serves as an anchor for muscles involved in posture and movement. It's not just a passive structure, it's dynamic, adapting to our movements and activities. So the next time you take a deep breath, remember the incredible rib cage working tirelessly to keep you alive and active. Here's a detailed overview of the rib cage. The rib cage consists of 24 ribs, 12 pairs, each consisting of a head, neck, tubercle, and shaft. The sternum is a long, flat bone in the center of the chest, composed of 3 parts: manubrium, body, and xiphoid process. Costal cartilages are hyaline cartilage connecting the ribs to the sternum. The rib cage protects organs by shielding the heart, lungs, and major blood vessels. It supports breathing as the ribs and sternum form the thoracic cage, which expands and contracts during respiration. It also provides attachment points for muscles, including those involved in respiration and upper limb movement. There are different types of ribs. True ribs, 1 to 7, are directly attached to the sternum via costal cartilages. False ribs, 8 to 12, are indirectly attached to the sternum via the 7th rib's costal cartilage, and floating ribs, 11 to 12, are not attached to the sternum or any other rib. The joints and movements of the rib cage include costovertebral joints, where ribs articulate with the thoracic vertebrae, costosternal joints, where ribs articulate with the sternum via costal cartilages, and the expansion and contraction of ribs that move upward and outward during inhalation, and downward and inward during exhalation. The clinical significance of the rib cage includes rib fractures, which can cause respiratory distress, pneumothorax, or hemorrhage, costochondritis, which is inflammation of the costal cartilages causing chest pain and tenderness, and thoracic outlet syndrome, which involves compression of nerves and blood vessels between the ribs and clavicle. The axial skeleton, our body's central framework, is crucial for support and protection. Diseases affecting it can lead to serious complications. Take osteoporosis, for instance. It weakens bones, making them fragile and prone to fractures. Then there's scoliosis, a curvature of the spine that can cause discomfort and affect posture. Imagine living with chronic pain from conditions like ankylosing spondylitis, where inflammation leads to stiffness and fusion of the spine. These diseases not only impact mobility, but can also affect overall quality of life. Understanding these conditions is vital for early detection and effective management. The axial skeleton may seem sturdy, but it requires our attention and care to maintain its health. Here are some common diseases and conditions that affect the axial skeleton. Osteoporosis, weakening of bones, leading to increased risk of fractures. Degenerative disc disease, wear and tear on spinal discs, causing back pain and stiffness. Spinal stenosis, narrowing of the spinal canal, compressing nerves and causing pain. Ankylosing spondylitis, inflammation of spinal joints, leading to fusion and stiffness. Rheumatoid arthritis, inflammation of joints, including those in the axial skeleton. Psoriatic arthritis, inflammation of joints, including those in the axial skeleton, associated with psoriasis. Osteomyelitis, infection of bone tissue, which can affect the axial skeleton. Discitis, infection of spinal discs. Spinal epidural abscess, collection of pus in the spinal canal. Osteosarcoma, cancer of bone tissue, which can affect the axial skeleton. Multiple myeloma, cancer of plasma cells in bone marrow. Metastatic cancer, cancer that spreads to the axial skeleton from other parts of the body. Spina bifida, birth defect where the spinal cord and vertebrae don't properly form. Scoliosis, abnormal curvature of the spine. Achondroplasia, genetic disorder that affects bone growth, leading to short stature and spinal problems. Fractures, breaks in bones, which can affect the axial skeleton. Herniated discs, rupture of spinal discs, which can compress nerves. Spinal cord injuries, trauma to the spinal cord, which can cause paralysis or other neurological problems. These are just some of the diseases and conditions that can affect the axial skeleton. Osteoporosis is a condition that weakens bones, making them fragile and more likely to break. Imagine your bones as a sturdy house. Over time, if the foundation crumbles, the structure becomes unsafe. That's what happens with osteoporosis. It often sneaks up on you, especially after menopause or with aging, as bone density decreases. Risk factors include a lack of calcium and vitamin D, sedentary lifestyles, and even certain medications. The scary part? Many people don't realize they have it until they suffer a fracture. But there's good news. Regular weight-bearing exercises, a balanced diet rich in calcium, and lifestyle changes can help strengthen your bones. So let's take care of our skeletal health. After all, strong bones mean a stronger you. Osteoporosis is a chronic condition characterized by the progressive weakening of bones, making them more susceptible to fractures. Hormonal changes such as a decrease in estrogen levels during menopause or androgen levels in men contribute to this condition. Aging naturally causes bone loss, and genetics can play a role if there's a family history of osteoporosis. Lifestyle factors like a sedentary lifestyle, smoking, and excessive alcohol consumption also increase risk. Certain medical conditions, such as thyroid disorders, rheumatoid arthritis, and Crohn's disease, along with long-term use of medications like corticosteroids, anticonvulsants, and certain antidepressants, can further exacerbate the issue. Symptoms of osteoporosis include back pain due to vertebral compression fractures, loss of height over time as vertebrae compress, easily broken bones, especially in the hips, spine, and wrists, and posture changes like stooping or hunching. Diagnosis typically involves a bone mineral density test that measures bone density using dual energy X-ray absorptiometry, X-rays to visualize fractures or bone loss, computed tomography scans for detailed images of bones, and blood tests to check for underlying medical conditions. Treatment options include medications like bisphosphonates, teriparatide, and denosumab to slow bone loss and increase bone density, hormone replacement therapy for women with postmenopausal osteoporosis, lifestyle modifications such as regular exercise and a balanced diet, and fall prevention strategies to avoid accidents. To prevent osteoporosis, it's essential to maintain a healthy lifestyle with regular exercise, a balanced diet, and avoiding smoking and excessive alcohol consumption. Ensuring adequate calcium and vitamin D intake through diet or supplements is crucial, as is engaging in weight-bearing and resistance exercises to strengthen bones. Getting enough sleep, aiming for 7 to 8 hours per night, also plays a role in overall health. Complications of osteoporosis include an increased risk of fractures, especially in the hips, spine, and wrists, chronic pain due to fractures or bone degeneration, potential disability and loss of independence, and an increased risk of mortality due to fractures and related complications.